हेलो फ्रेंड्स, वेलकम टू ऑनलाइन गुरु प्लेटफॉर्म पे आपका सहर्ष स्वागत है। टुडेज आवर टॉपिक ऑफ डिस्कशन इज मल्टीपल चॉइस क्वेश्चंस ऑन द टॉपिक दैट इज फार्मास्यूटिकल डोसेज फॉर्म। फॉर मोर डिटेल्स you can download our app from Play Store, and for more details related to the practice session as well as quiz, you can join our Telegram channel. The link is being given in the description. So let's start with the today's session. Which form of the dosage form in which the drug will have highest bioavailability? First of all, I am going to tell you what is bioavailability. It is the rate and extent of drug absorption. How much drug is being absorbed into the blood is going to be decided with respect to bioavailability. Rate means the actual speed at which the drug going to get absorbed, and extent means the concentration of drug which is going to get absorbed into the blood. This is going to called as bioavailability. The options are A. Capsules, B. Solutions, C. Tablets, and D. Emulsions. So let's see the correct answer. The correct answer is solution. Why it is so? Solution is a monophasic liquid. See here. First of all, we are going to discuss with respect to tablets. The tablets, when we are going to take it orally, it is going to undergo disintegration to release the granules. The tablet is going to break down to release the granules. These granules will undergo the process of dissolution. Means these granules are going to get dissolved in the GI fluids, and it is going to convert into solution, and this solution is going to be absorbed from the GI tract into the blood. This process is called as absorption. Then this is a capsule which consists of gelatin shell. When it will come into the GI fluid, it is going to, this particular gelatin shell is going to get dissolved and release the granules. These granules will undergo dissolution to form a solution. This solution is also going to get absorbed from the GI tract into the blood. While in the case of emulsions, suppose this is a oil droplets which are being dispersed in the dispersion medium, that is water. This is a O by W emulsion. This will dissolve inside the GI fluid to form a solution and will get absorbed into the blood. But when we are going to take the solution directly into our GIT via oral route, then what will happen? There is no steps involved. This solution is already a solution form. It is directly going to absorb into the blood. Means these all the process, that is disintegration, dissolution, it has been bypassed in the solution. Hence, solution will have highest bioavailability as compared to that emulsions, capsules as well as tablets. Second question, capsules in which powders are enclosed are made up of? Means the outermost shell of the capsule, what is it is made up of? A is gelatin, B is rice flour, C is fructose, D is dextrose. The right answer is gelatin. See here, gelatin is obtained from the actual collagens of the particular animals. See here, any muscle or blood vessel is having an underlying collagen fibers. These collagen fibers from animals can be used to prepare gelatin. This gelatin is made for the synthesis of this particular capsule shell. This is called as capsule shell. This capsule shell is made up of gelatin. It is translucent, it is odorless, as well as it is tasteless. The third question, bulk powders are A. potent, B. non-potent, C. both A and B, and D. none of the above. The answer is non-potent. See here, potent as well as non-potent means the potent drugs or dosage forms are having a highest accuracy, while non-potent dosage forms like bulk powder are not having accuracy. Bulk powders, take an example, crocin, it will have 500 milligram of paracetamol. Crocin will have 500 milligram of paracetamol. It is a potent dose, unit dose. It is a highly accurate dose in contrast with this bulk powder. But when we are going to speak with respect to this particular bulk powder, it is not having a specific dose. Hence, it is non-potent. It is not having accuracy. It is a multi-dose preparation. Then fourth question, powders are more stable than A. Syrup, B. Tablet, C. Capsule and D. Elixir. See here, the correct answer is syrup. Why it is so, we are going to discuss. See here, powders are in solid form. They are not having any water molecule in it. While syrup are the base is water in which the sugar is being dissolved. While with respect to the tablets, it is a solid dosage form. Capsule is also solid dosage form. Elixir is a hydroalcoholic solution. What will happen? When there is any water is present inside a dosage form, water will act as a medium. It will act a favorable condition, a growth promoting factor for the growth and development as well as multiplication of microorganisms. And hence, this microorganisms is going to degrade the dosage form as well as the drug. So, it is not stable. Hence, syrup, it is a liquid formulation, is not stable as compared with that of powders, tablets and capsule. But what about elixir? It is also a liquid formulation, but still it is more stable than syrup. Why it is so? Because elixir along with water, elixir will also contain alcohol. And as you know, alcohol will cause the destruction of the microorganisms. It will have a lethal impact on the microorganisms. Also, it is going to inhibit the growth of microorganisms. Hence, elixir will have somewhat greater protective action. They are having some greater stability as compared to that of the syrups. The next question, the monophasic liquid dosage form is option A, solution, option B, suspension, option C, emulsion and option D, none of the above. The correct answer is solution. See here, what is the meaning of mono? Mono means single phase. When we are going to speak with respect to suspension, there is an insoluble solid dispersed in liquid. It may be water. Okay, so it is a biphasic. It is biphasic. Suspension is biphasic. Emulsion, it may also the oil droplets which are being dispersed in the dispersion medium, that is water, in O by W type of emulsion. It is also having two phases, hence it is also biphasic. But when we are going to speak with respect to solutions, there is no any dispersed phase, no dispersed phase, there is only a single phase, hence it is called as monophasic. As it is having only one phase, it is called as monophasic liquids. The next question, enemas are administered, option A, rectally, option B, orally, option C, parenterally and option D, externally. The right answer is rectally. The enemas are to be inserted into the rectal cavity. See here, this is the particular, suppose this is a rectal cavity, enema tube is been inserted in this particular rectal cavity. Okay, which will contain some medication, which through this pipe the enema is going to go inside the rectal cavity, where it will cause the movement or evacuation of bowel. Bowel is the tubes, the rectal tubes, which will facilitate the elimination of the feces or the stools from the body. But due to less water intake or hardening of stools, these stools cannot pass through these bowels. Hence, for the sake of evacuation of this bowel, the enemas are given. The enemas will cause, it will increase the water accumulation. This medication will contain some drugs which will increase the water accumulation inside the stools. Means the stools are going to get softened due to water accumulation, and also it is going to increase the bowel movement, which will cause peristaltic wave to eliminate the stool from the bowel and through the rectal cavity. Means collectively it will cause the evacuation of bowel, means the stools are being removed from the body. Hence enemas are mostly administered rectally to have a localized effect. See the diagram. This is the actual particular rectal cavity through which the pipe is being inserted and medication is being transported inside the rectum. Seventh question, propellants are used in aerosol. Aerosol, it will contain any medication. Mostly it is for our respiratory tract infections. Okay, it has to be inserted into the nasal capillaries. Okay, and what will the propellants will cause? See here, suppose this is a particular aerosol container. It will contain drug and it will contain some gas called as propellants. When there is the nozzle is being pressed, it will generate a pressure inside the particular container, and these propellants will push the drug outside the container. Means the propellants will expel the drug from the aerosol container. Hence the correct answer is, it is going to develop the pressure to expel the drug from the container. The correct answer is option B. Let's see the diagram. See here, it is the particular, this is the propellant, this is the propellant, this is the product, that is a drug. When there is the nozzle is being pressed, there is these propellants are going to generate a pressure inside the container which will expel the drug from the container outside, so that drug can be released outside the container. The next question, suspending agent imparts option A solubility, option B viscosity, option C absorption, and option D weighting. See here, the actual answer is viscosity. What will happen? See here, we are going to discuss it diagrammatically. This is the suspending agent. We are going to add, see here, these particular insoluble particles which are dispersed in this dispersion medium are going to sediment due to less density of or less viscosity of the particular dispersion medium. Then we are going to add this suspending agent which is going to increase the viscosity of the dispersion medium. In turn, it is going to increase the density of the dispersion medium. Then what will happen? Due to increased density of the dispersion medium, the sediments, the actual insoluble particles are not going to settle down. They are not going to sediment. Hence, they are uniformly distributed throughout the dispersion medium, and our suspension will remain stable for a prolonged period of time. This is the actual motive of addition of suspending agents, to increase the viscosity. In turn, it will increase the density of the dispersion medium and maintains the stability of the suspension for a prolonged duration of time. Then ninth question, nasal drops are A isotonic, B hypertonic, C hypotonic, and D none. The correct answer is isotonic. So we are going to discuss what is actually the tonicity. See here, suppose this is solution A, this is solution B, this is solution A, this is solution B. Both the solutions are being separated by a semi-permeable membrane. This is a semi-permeable membrane. The actual concentration of solute, in this, when it is going to be equal with the actual concentration of solute in solution B, the concentration of solute in solution A should be equal with the actual concentration of solute in the solution B. Then we can say both are isotonic with each other. In the case when there is when we are going to discuss with respect to hypotonic, the actual solution, the solute concentration in the solution A is having more concentrated. The solutes are more concentrated with respect to that of the solution B. In the case of hypotonic, the actual solute concentration is very less as compared to that of the solution B. This is actually what is called as tonicity. Tonicity means the actual solute concentration in the solution. It is called as tonicity. And iso means same. Same tonicity means same solute concentration in both of the solution, which are being separated by a semi-permeable membrane through which the solutes can easily move on. Okay, this is actually we are going to discuss what is isotonic solutions. See here, the actual solute concentration is same of the isotonic solution with respect to that of the nasal fluids. Nasal fluids are the nasal secretion which are present in the nasal cavity. So what will happen if we are going to use hypotonic or hypertonic solutions? They are going to cause the degradation or damage to the nasal capillaries. Hence, to prevent these problems, the particular formulations are being formulated by addition of some isotonicity modifiers which are going to maintain the isotonicity of the particular formulation so that there is no any damage to the nasal blood capillaries. Then the 10th question, the first pharmacy shop was being opened in option A is London, option B is Baghdad, option C is Bangalore, and option D is Damascus. The correct answer is Baghdad. Baghdad is the capital of country Iraq. The first pharmacy was being opened in Baghdad in 754 AD, and the ruling particular empire was Abbasid Empire. See here the diagram of the first pharmacy shop. Then the 11th question, which is an example of the NDDS, that is novel drug delivery system. Option A, sustained release dosage form. Option B, controlled release dosage form. Option C, mucoadhesive drug delivery system. Option D, all of the above. The correct answer is all of the above. See here, what is sustained release? Suppose this is the drug. This is the drug. This is the polymer which is going to prolong or extend or sustain the release of the drug from the tablet or dosage form. See here, this particular drug is going to get released through this polymer for prolonged period of time in the case of sustained release dosage form. But in the sustained release, the drug is not going to be released at a constant rate. Means in first hour it is going to release 50 milligram of drug, but in second hour it can release 100 milligram of drug in the case of sustained release dosage form. In contrast with this particular concept, the controlled release dosage form, they are also going to sustain the release of the drug, but one feature is important in the controlled release dosage form. It is the release of the drug is been predicted kinetically. Means the actual release of the drug can be controlled. Means in 1 hour it will release 100 milligram of drug. In the second hour it will release same, that is 100 milligram of the drug. Means the actual concentration of the drug which is been released in each hour, it is constant. We can control it. Hence it is called as controlled release dosage form. And speaking about the mucoadhesive drug delivery system, this is a mucoadhesive tablet. It will contain some polymers which are going to get dissolved in the influence of body cavities or body fluids. What will happen? This particular tablet, when it attaches to the mucous membrane, this polymer is going to get dissolved and it is going to stick this tablet to the particular mucous surface. And through this particular mucous surface, the drug is going to release this drug for a sustained period of time. Hence, all the drugs, all these 3 types of tablets are going to release the drug for a prolonged period. And as you know, novel drug delivery system is the initiative or innovative approach of modifying the drug release for its prolonged effect in our body. and hence all the particular dosage forms are the examples of novel drug delivery system. Hence the correct answer is particular all of the above. The next question, which type of drug delivery system will provide site-specific drug delivery to the target specific disease area and minimizes the side effect? Option A is transdermal drug delivery system. Option B is gastroretentive drug delivery system. Option C is nasopulmonary drug delivery system. Option D is targeted drug delivery system. The correct answer is targeted drug delivery system. When we are going to discuss the transdermal drug delivery system, it is a drug delivery system which will release the drug in the dermis or the skin. While with respect to gastroretentive drug delivery system, we are going to retain the tablet in our stomach so that the drug can be absorbed from the stomach lining. While in the case of nasopulmonary drug delivery system, we are going to take drug via our nose, so that the drug can have a localized effect in our nose or our lungs. But when we are going to speak with respect to targeted drug delivery system, it is highly specific. It is very specific with respect to the target site. When we are going to take any drug, example anti-cancer drug, it is going to reach towards its site and it is only going to specifically act on the tumor cells. When we are going to speak with respect to the liposomes, reseed reloaded erythrocytes and nanoparticles, this dosage form is been designed to release a drug towards only the target site, that is the tumor cells. It is not going to affect the normal healthy cells. That's why it is called as targeted drug delivery system, because the dosage form is going to release the drug which is going to specifically target the target site itself. It is not going to affect the other particular healthy cells, means it is going to prevent the collateral damage which is going to cause by the use of conventional dosage form. Then the 13th question, phase inversion will take place in A, suspension, B, emulsion, C, solution, D, elixir. The correct answer is emulsion. See here, when this is a oil in water emulsion, the oil droplets are a dispersed phase and this particular water is a dispersion medium. Okay, water is a dispersion medium. When we are going to add excess of dispersed phase, that is oil, to this oil in water emulsion, what will happen? There is a conversion of this emulsion to water in oil emulsion. Means the actual concentration of the oil is going to get increased as compared to that of water. Hence, there is a phase transition or phase conversion or phase inversion from oil in water emulsion to water in oil immersion when there is addition of the dispersed phase, that is oil in this case. Okay. Next question is 14th question. Dosage form which release drug into intestine are A, film coated tablets, B, enteric coated tablets, C, gastroretentive tablets, D, both B and C. The correct answer is enteric coated tablet. It is also called as delayed release tablet. See here, enteric coated tablet, enteron means intestine. Enteron means intestine. See here, this is a drug. This is the drug. This is a polymer. Red part is a polymer. It is enteric coating polymer. This polymer is not going to be degraded at acidic pH of the stomach. This polymer is only going to get degraded at an alkaline pH, that is pH more than 7. It is going to be degraded in the intestinal pH. Okay. See here, when we are going to take this drug orally via oral administration, this tablet has reached into the stomach. In the stomach at the acidic pH, there is no impact of the low pH, that is acidic pH, on this particular polymer. Hence the drug is not going to release its contents into the stomach. But when this drug will go into the intestine after the gastric emptying time, this particular this polymer at a increased pH, that is intestinal pH, alkaline pH, this polymer is going to get degraded and this drug is going to get released into the intestine. Hence the name it is been given. It is enteric coated tablets. Means these tablets are going to release its contents into the intestine. It is also called as delayed release tablets. Then the 15th question, which type of dosage form will bypass first pass effect? A is oral solution, B is tablets, C is capsules, and D is sublingual tablets. The correct answer is sublingual tablets. See here, firstly we are going to discuss what is first pass effect. See here, when we are going to take drugs orally, it may be oral solutions, tablets or capsules. It will go into stomach or intestine, that is GIT. From there it will move to liver via hepatic portal vein. And from liver it is going to move again to systemic circulation. Then this entire process, this is a journey of the drug, that is ADME. In this we are going to study, there are some particular enzymes which are being present in this particular gastrointestinal tract as well as liver. It is called as the gut wall enzymes present in the gut wall enzymes, luminal enzymes present in the lumen, intestinal enzymes present in the intestine, and hepatic enzymes present in the liver. During the journey of the drug through these particular organs, what will happen? The drug's concentration is being significantly reduced. If the drug's concentration is 100 milligram, it is going to reduce to 70 milligram. Why it is so? Because some part of the drug is going to get metabolized due to the influence of these enzymes. These enzymes, that is gut wall enzymes, luminal enzymes, intestinal enzymes, hepatic enzymes, are going to metabolize the drug and reduce the concentration of drug, which is going to reach it towards its target or blood. And this particular process or this particular metabolism of the drug before it is reaching into the blood, means before absorption of blood of the drug into the blood, it is called as pre-systemic metabolism. Means the particular metabolism of drug before reaching into the blood, it is called as pre-systemic metabolism, also known as first pass effect or first pass metabolism. When we are going to take drug sublingually, means beneath the tongue, there are some fine blood capillaries which are located beneath our tongue. Then what will happen? The drug from these capillaries is directly going to absorb inside the blood. The drug will directly reach towards the blood, and this particular pathway of travel of the drug in the GIT, liver and to the blood is been bypassed. Hence sublingual drugs will going to bypass the first pass effect or first pass metabolism, also known as pre-systemic metabolism. Then thank you for the lecture. We are going to discuss some more topics with respect to this particular sessions, that is the MCQs on pharmaceutics, in our next lecture. Then thank you.